Ho, ho, ho! Merry Christmas! It's me, Santa Claus, and I'm going to talk to you about a brand new drug called Idelvion. This drug is to treat hemophilia B patients, otherwise known as Christmas disease. Idelvion was specially approved for use in children and adults with hemophilia B for routine prophylaxis to prevent or reduce frequency of bleeding episodes, on-demand control and prevention of bleeding episodes, and perioperative management of bleeding. It is a recumbent protein that temporarily replaces the missing coagulation factor 9 needed for effective hemostasis. Idelvion is comprised of genetically fused recumbent coagulation factor 9 and recumbent albumin. Fusion with recumbent albumin extends the half-life of factor 9. The administration of Idelvion increases plasma levels of factor 9 and can temporarily correct coagulation deficit in patients. The pharmacological class is clotting factors and is produced by a company known as CSL Behring. The generic name would be coagulation factor 9 recumbent albumin fusion protein. Dosing for Idelvion is body weight times desired fixed increase or percent of normal international units per deciliter of factor 9. For bleeding, minor to moderate increase of 30 to 60% required. You repeat the dose 48 to 72 hours for equal than or greater than 1 day until bleeding stops and healing is achieved. For a major increase, 60 to 100%, repeat every 48 to 72 hours for 7 to 14 days until bleeding stops and healing is achieved. Give maintenance dose weekly. Perioperative, for minor, 50 to 80%, repeat 48 to 72 hours for greater than or equal to 1 day until healing is achieved. Major is the same, 48 to 72 hours, but for 7 to 14 days or until bleeding stops and healing is achieved. You can repeat every 48 to 72 hours for the first week or until healing is achieved, giving maintenance dose 1 to 2 times weekly. For routine prophylaxis, for greater than or equal to 12 years old, 25 to 40 international units per kilogram every 7 days, or if well controlled, may be given 50 to 75 international units per kilogram every 14 days. And in children less than 12, it would be 40 to 55 international units per kilogram every 7 days. Contraindicated with people with a hamster protein sensitivity. There are trace elements of hamster protein in the product. Warnings and precautions include allergic reactions. Product contains, again, trace elements of hamster proteins. If symptoms of an allergic reaction occur, you should stop using the medicine immediately and contact your doctor. Because of the risk of allergic reactions with factor 9, your initial administration of Idelvion should be performed under medical observation where proper medical care for allergic reactions can be provided. The formation of inhibitors or neutralizing antibodies is a known complication that can occur during treatment, which stops the treatment from working. If your bleeding is not being controlled, tell your doctor immediately, and you should be monitored for the development of these inhibitors. If you suffer from liver or cardiac disease, or if you had recent major surgery, please inform your doctor, as there is increased risk for blood clotting complications. If you need central venous access device, the risk for complications including local infections, bacteria in the blood, and thrombus where the catheter is inserted should be considered. There were no testing for pregnancy or lactation with this, and it should be only given in pregnancy if clearly needed. Idelvion contains 25.8 milligrams of sodium per dose. So for those that are on sodium restrictions,
that should be monitored. Adverse reactions with the medication are allergic type hypersensitivity and inhibitors created with the taking of the medication, which prevents the treatment from working. Side effects that have been observed may affect up to 1 in 10 people are headache and injection site reactions. Uncommonly affecting 1 in 100 people, dizziness, allergic reactions, rash, eczema. The side effects are expected to be the same amongst adults and children. Proper storage of Idelvion. Keep out of reach and sight of children. Do not use the medicine if expired. Do not store above 25 degrees Celsius. Do not freeze. Do not expose vials to direct heat. Vials must not be heated above body temperature. The reconstituted product should preferably be used immediately. Idelvion is presented as a pale yellow to white powder and is supplied with water for injections as a solvent. The reconstructed solution should be clear or slightly opalescent, yellow to colorless. It might sparkle when held up to the light, but must not contain obvious particles. Idelvion comes in 4 different dosage strengths: 250 international units, 500 international units, 1,000 international units, and 2,000 international units, and must be reconstituted with the respective supplied volume. For the 250 to the 1,000, it's reconstituted in 2.5 milliliters of sterile water. For the 2,000, it is reconstituted in 5 milliliters of sterile water. The package consists of 2 boxes: the product box, which contains 1 single-use vial and 1 vial of sterile water for injection. The device box, which contains 1 mix-2 vial, filter, transfer set, 1 syringe, 1 infusion set, and a plaster. The benefit of Idelvion is going to be the longer half-life, which now decreases routine doses from once or twice weekly to once every 2 weeks. So this is a big benefit to the patients that require this medication and gives them a lot more freedom. Well, I'd like to thank you all for your time in watching this video. I do hope it was informative for most of you in the class. But it is now time for me to get Santa's little helper here to bed. So thank you very much.